Hello there. Yeah. Come in, my friend. Come in, come in. Yeah, welcome to the doctor's office. So I have down here that you are on for a cranial nerve exam. Am I right? Alright, we'll see to you immediately. So I just have a few questions before we begin. You know, standard practice here. I don't want to meet the wrong patient and kind of things like that. So, can you do me a solid and can I get your first and last name and middle name if applicable? Okay. Okay. And when is your birthday? I need the year as well. Okay. Alright. Now, another thing I need is I need you to just answer a few questions about your health. Are you okay with that? Okay. And lastly, your home address. And if you have insurance today, you do. Okay. And who's that through? All right, my friend. All right. And your address. Okay. Is that a street or a way, avenue? Okay. And is that a city or town? It's a town. And what county is that in? Okay. And zip code. All right. So, now I have just a few health related questions for you, and then we'll be able to get started. So, over the past 10 days, have you experienced any, like flu symptoms, anything like that? No? Okay. Just going to verify really quickly and do a temperature check with this temperature thermometer thingy. Just going to beep. Okay. 98.62 degrees Fahrenheit. Alright. So you are good in that sense, so I'm not too worried about your temperature today. But the next thing I'm going to ask is, do you have any common illnesses or like health conditions in your family? You don't. Okay, good. And any sudden illness recently? No. Okay. Any history of a communicable disease? Okay, which ones? Okay. All right. And do you take any medication? You don't? Okay, good. Do you wear glasses at all? I might ask this because I need to know if we are going to test you wearing glasses today. Alright, so, the next thing we're going to do is, just going to finalize some of these questions. So, check a few boxes there. Alright, so you're pretty much cleared to go. And when was the last time you ate or drink? Okay. And how much soda would you say you drink a week? 2 to 3? Alright, we should probably try to cut back on that. That's not really good for you. Alright. And have you been noticing anything weird going on since the fall? No, you haven't? Okay. Alright. Now, first thing I'm going to have you do is I'm going to take this here, we're going to use this for a little bit, and I'm going to have you follow the pen light with your eyes, not your head. Good job. Alright. Now, the next thing I'm going to have you do is I am going to have you stare at my nose. I'm just going to. Good. Excellent. Good. Excellent. Good. 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 Excellent. Good. 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 Alright, excellent, my friend. Alright, so your eyes look pretty good. Pupil dilation's okay. Measure's alright. Just gonna write that down really quickly, and then we'll get on to the next test. So, patient Eyes follow nicely, and pupil dilation is normal. Okay. There's a bunch of check boxes on here I have to check off. If you hear me checking multiple things, don't think it's a bad thing, because if it's a bad thing, I will tell you. So the next thing I am going to do is we're going to do the color test. We're just going to finish everything vision off right away so we can move on to the tactile, tasting, and smell test. And then the balance test. So what I'm going to do is I have these markers here, and these are different colors, as you can see. So I'm going to pull a marker. What color is this marker? Good, it's orange. How about this one? Excellent, pink. Good, orange. Good, blue, my bad. Purple, excellent, my friend. All right, so now I am going to hold it. Tell me which ones are in my right hand. Good. Which hand is the purple in? Good. Which hand is the blue marker in? And which hand is the pink marker in? Good. Have you been having any trouble with your color vision at all? No, you haven't? All right. Color vision, okay. Patient doesn't report any issues with color vision. So the next thing I am going to do is we are going to test your ears just to make sure that you can still hear. I'm going to poke around your ears really quickly and just kind of take a look around. I'm going to use my little ear kit here. Just as you can see, there are just a slight bit of tools. I'm just going to poke in your ears and make sure that, everything is okay and that there's like no earwax buildup. Alright. So I'm going to have you close your eyes, and I'm going to whisper into your ear a series of numbers, and I'm going to have you repeat them back to me, okay? All right, close your eyes. 1, 2, 3. Good. 7, 9, 5. Good. 8, 9, 10. Good. 1, 4, 1. Good. 0, 6, 7. Good. All right, my friends. So you're doing pretty well. I'm just gonna take a quick look in your ear really quickly, and I'm just gonna see if I can just like can you hear me? All right. That ear is pretty clear. Didn't get much out. And that one's pretty good too. All right. So it looks like your ears are pretty much good to go. And really what that means is that you're completely okay. Your hearing should be fine. But we still have a few more tests to run. And I do have to write it down that we did pass those tests. So and basically we are going to revisit these markers again. And when we revisit these markers, we are going to just do the taste and smell test. These are my patented, pending Ty's ASMR markers. Honestly, if you guys don't know who Ty's ASMR is, he's a really cool YouTuber who can help you sleep. You told me you're having sleeping trouble, so definitely subscribe to his channel, comment, and hit that like button. But enough advertising, let's get back into the doctor's appointment. So, have you taste this really quickly? Good. All right. That is bubblegum. Good. And smell it. Grapefruit. Excellent. Yes, I actually forgot to tell you before we started, but these are very deceiving. They do not smell like they taste. Candy, good. Kool-Aid, excellent. Another one. Medicine. Oh, that's grape. I'll give that one to you. Good. Used film. Well, that one is film. I'm gonna have to contact Ty's ASMR about that one because that one's a weird one. Alright, and then that one here. Orange, excellent. Let's give it a sniff. It smells like slime. Like the scented stuff from the store. Okay. You are right. Yeah, I'm gonna have to talk to Ty's ASMR about some of this stuff. Because quite frankly, some of the stuff he gave me, it's a little weird. I don't like it, but you know what it is. And the next one we have is this last one here. What are you talking about? I'm holding something. You can't see it? I don't know how you can't see that. Okay, well, it's going to... You don't taste anything either? It's not there? Okay. Alright, so the next thing we are going to do, we did the taste and smell. We're going to move on to your tactile senses. So that meaning we're going to test and see if you can feel like rough versus soft. Alright, so the next thing we have is this. I'm just going to roll it like that. You're either going to say rough or smooth. So I'm just going to roll it on you like this. That's rough. Excellent. Smooth. Alright, and I should have said you have to close your eyes. Good. Smooth. Excellent. Roll rough. Good. And smooth. Excellent. Alright, so you could tell the difference with this? Alright. Okay, good. Now, going to hold this for a second to warm it up and leave this as a cool in. So what we're going to do next is we're going to test your warm and soft senses. Just have to write down the things there. But so that's warming up. It's warm to the touch compared to that, yes. Alright, so put your I'm going to touch this to your arm or maybe your base, and you're going to tell me if it's warm or cold. Alright. Close your eyes. Good. 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 Excellent. Alright, so you answered all those right. So, the next thing we're going to do is actually the last thing before I can cut you loose out of my office. So, what I'm going to do is I'm going to have you stand still, just kind of put your arms on your side, and I'm going to try to knock you off your balance. So, just close your eyes and try to stay balanced. Alright, good. Now, keep your eyes tight, 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 and don't let me open them. Excellent. Now, shrug your shoulders like you don't know what to do, and don't let me push them down. Excellent. Alright, so that's everything for today. Let me just tally your results and do a quick exit survey. Alright, so you passed everything. I am a little concerned that you did not see that marker earlier today. So I'm going to refer you to an optometrist to get your eyes checked. But that is really it. So check with the receptionist. She'll get you all set up. to get and see the optometrist, and then you'll get a date. Just go. Worst case scenario, I'm wrong, but there was a marker there and you didn't see it. So thank you for stopping in. Do you have any questions? No? Okay. Alright, my friend. Well, I hope you feel better. I hope your head gets better. And I'll see you later. But hopefully not too soon. Alright.